With us right now is clinical psychologist Dr. John Duffy, a friend of the show, and good morning to you. As always, we want to talk about these really important issues, but give parents some context. I think for a lot of us, we know that mental health is an issue that every single person on the planet is dealing with right now, especially after the past year and a half. But specifically with young people, was there always this bubbling mental health crisis? It's just that finally the pandemic is sparking people's attention?
I love the way you just put that. Exactly true. I mean, those of us in my profession are so relieved that we've declared a crisis, oddly enough, because pre-pandemic, we were worried about the mental wellness of young people. And when you take away all the social contact, take away counselors, teachers for a year and a half, and make the future uncertain, as Nick was just saying, the mental illness that kids are suffering just increases exponentially, and unless we do something to stem the tide, that's going to continue to happen.
Right. What do we need to do to stem the tide? I mean, I'm sure that there are those in your profession who've been like crying out, you know, we need to do something urgently. What kinds of solutions should we have implemented years ago?
Yes. So we need parents, first of all, involved in the mental wellness of their kids. So we need to train parents probably through school districts on social emotional learning, what to look for in terms of mental illness in their kids. And we also need a whole lot of people in my field who are trained not just in the treatment of mental illness, but specifically what young people are dealing with, which is ever evolving.
Yeah, well, the social media world has changed. I mean, when you think about MySpace and what AOL and Yahoo Messenger were like, to the vivid imagery and immersive technology that we have today on a number of different social media platforms, what do we need to do to change the impact of social media on kids?
Well, we need to take some of the onus off of kids, right? Because this is really enticing stuff, you know, social media right now. And it's a way that kids connect with one another. Yeah. So it's not all bad. But as Nick was also saying, you know, Instagram and TikTok and some of the other social media platforms are so enticing in a negative way, right? So they're drawing kids into subject matter that involves eating disorders and depression and anxiety
and drugs.
Drugs, and they can spend hours on these things. And that really is detrimental to their well-being.
But it seems to be that, you know, you can't just flip a switch and unplug social media dangers. There has to be something deposited in the hearts and minds of our kids that's not being implemented in schools or in families. What is the missing ingredient?
A big part of it is that we are not modeling as parents, as adults, very well how to manage our time on social media, how to manage what we're looking at on social media. So our kids are actually turning to us for cues, and we're actually failing that on the whole.
Well, the parents are having a mental health issue a lot of times too.
Exactly right.
Yeah, so yes. Everybody's struggling together. Can we all be treated together?
We can absolutely all be treated together. I do think that this moment with the Surgeon General and this crisis allows us the opportunity to kind of come together and come up with a comprehensive method for treating the whole family so that mental wellness is established kind of across the board.
Yeah, ask for help. We mentioned some resources online, but certainly maybe even contact your doctor, your physician, your family physician. Maybe they have resources for mental health and counseling.
Undoubtedly they will.
Yeah.
Absolutely.
Thank you so much, Dr. Duffy, for being with us. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.